My name's Kevin Lockhead. I'm the owner and clinical director of Edinburgh Dental Specialists, and I'm one of the 12 specialist dentists working here. My particular area is prosthodontics, which in essence means that I'm the architect of the advanced restorative treatment plans that we carry out for patients. All-on-4 is a term that's been coined by the manufacturers for a technique, and that technique is a way in which we can take patients who, for whatever reason, might have come to the end of the road with their existing teeth to a brand new set of teeth in one day. Edinburgh Dental Specialists has been working with the nation's dentists providing solutions for complicated dental problems for almost 18 years now. And the facility we have in the practice with 12 specialist dentists and our on-site laboratory means that in order to provide the all-on-4 technique, we're perfectly positioned because we can keep everything in-house. We have the surgeons here, we have the prosthodontists, and we have the laboratory so that everything can be done within one day, confidently and predictably.
Well, I've been one of these fortunate individuals that all my life I've had good teeth. That is up until 2 years ago. Then I've been subject to quite a lot of hospitalisation for a complex situation involving the heart and lungs, which goes back to major surgery that was done on the heart in 1991. Amidst all this, something went wrong with my top teeth, and then I was effectively left with 4 front teeth, which are all crowns. So I had to have a denture. I honestly have to say I struggle with it. I don't eat well with it. Food sticks to my mouth all the time. Worst of all, I feel myself often talking with a bit of a lisp.
For so many patients, this technique is something they've been waiting for. Previous to the all-on-4 technique, patients were having to admit to the idea that they would have to lose their teeth and proceed to a complete denture. And for many people, that's just something they're not willing to accept. With the all-on-4 technique, we're now able to take a patient entirely painlessly in a single day from their hopeless situation to having a brand new set of teeth again. And they can leave behind all the problems and the worries they had with that old set of teeth.
When I mentioned that Professor Level would actually do the surgery, his reputation was such that they felt confident in giving me a green light to go with this.
Well, the gentleman we worked on today was someone who has spent some time with the prosthodontist, the dentist, who has talked him through the various options, what his problems are, has discerned what he's looking for, and then has given him a number of options from which to choose. He elected to follow the pathway of removal of his upper teeth with the placement of 4 implants. This best met his budget, and clinically we were able to do this because of the bone available, and onto which the 4 implants he is going to have a fixed prosthesis eventually placed.
There are 3 critical aspects to all-on-4. The first is the designing of the case, and that's down to the prosthodontist, who is effectively the architect of the whole case, and that in this situation would be me. And I spend time with the patient before we begin, really establishing what they want to try and achieve and the problems that they're currently experiencing, so that I can be absolutely sure that before the patient goes ahead, what we're going to achieve for them is going to satisfy their requirements.
The 2 things I'm hoping will change significant for me is my speech and my eating, backed up closely by comfort. So I'm hoping that the result at the end of the day will be immensely better all round.
The second critical factor in the all-on-4 technique is the skill of the surgeon. It's absolutely essential that the surgeon has very detailed knowledge and a skill set which allows him to place the implants where we need them in order to provide the bridge for the patient on that day.
As a practitioner, it is immensely satisfying to be able to allay the patient's fears and use equipment that one can rely on and complete this task within a day and send them on their way, usually very satisfied with what has been undertaken.
We're extremely fortunate in having the services of 4 specialist oral surgeons working within the practice, all of whom are very capable at carrying out this technique.
here I felt there was a feeling of this order and calm and professional care, and that stood out for me first of all. And then in speaking with the staff here and getting more involved, I became more assured that what was being proposed was right for me. And you know, they talked me through it all, made me clear as to all the points of the procedure, but at no point was I pressurised. It was really left to me to make the decision, would I go or would I not go. I would say here the quality of approach to this is first class.
If you open again, it does take a wee bit more to adjust it at the end of the day than fine. So I've got contacts on posteriors and anteriors and space for the tension to trim that, so I'm happy with that to my vertical. They'll take away all the soft tissue. The third and final critical factor in this technique is the availability of an on-site laboratory. What we're doing with the all-in-4 technique is manufacturing a bridge to fit on the implants as the same day that the implants are placed. And to make this work, we need to have the facility of very skilled technicians actually here at the time that the patient's being treated. To this end, we've got our own on-site laboratory with 7 technicians, all of whom, again, are very familiar with the system and are capable of producing the finest provisional bridge work and indeed the final bridge work when we get to that.
I'm Bruce Innes, I'm the pros technician at Edinburgh Dental Specialists. From the moment we receive the impressions, they immediately go through to the plaster room, at which stage a soft tissue model will be created and articulated up on the impression given. The overall aim is to get the patient in a stable situation as soon as possible. The aim is 2 hours from completion of surgery to effectively the bridge being fitted.
From a patient's point of view, it's really the answer they've been looking for. Many people have got to the situation where they've come to the end of the road with their natural teeth, and they're having to accept the fact that the next step is to lose these teeth and move on to complete dentures, or indeed they may be in that situation already and finding it in some cases intolerable, where they can't enjoy food in the way they would like to. Speech can be challenging, socially they find it embarrassing, and they feel crippled by their teeth. With the all-in-4 technique, we can change that very, very quickly and predictably. The biggest problem with all-in-4 is so many people don't know it exists. And in many cases it rejuvenates the patients, it allows them to interact in a way they've not been able to do for years, to be able to eat what they want to eat, to be able to socialise and really get on with their lives and regain their confidence and dignity that unfortunately has been lost through, as their teeth have been lost as well. See what you think.
It's good. Wife will maybe recognise me. Good, yes. I wouldn't want to do this every Tuesday. I really feel good. I mean, I'm a bit uncomfortable and tired now, but I think the result is good. The teeth, new temporary teeth anyway, are looking good, which really makes me feel that the final result will be even better. So it's good, and the fact I don't have this plate in my mouth is a big step forward. This feels a bit strange, but give it a day or two and I think I'll be good. Thanks, Jim. Hope you learned something.